Welcome back to another episode of the Empowerful Health podcast. I'm the host, Jeremy Kerrigan. We got a great guest today, Tanner Hawk. Thanks for being here, Tanner.
Yeah, thanks for having me.
Tanner's a physical therapist. He's going to talk to us a little bit about his, what did I call it? The on-again, off-again relationship with healthcare. Some of the reasons why he left, and then some of the reasons why he came back. We're going to discuss a little bit more like logistics of healthcare today, some of the downfalls, the challenges that practitioners face, the quality of care that gets diminished as things maybe get too big, as practices become, I think, homogenized is probably a good word. And so people lose that personal touch. So yeah, tell us a little bit about yourself, like how you got into physical therapy, and just give us a little introduction.
Yeah, for sure. So, like a lot of physical therapists, my introduction to physical therapy was through playing sports.
Sure.
So I was a big time baseball player, grew up here in Gilbert. So I played at Mesquite High School. I think it was my junior year. I just had some problems with my elbow. So I went to physical therapy. I wish that I remembered where I went. I don't even remember where I went at this point. But thankfully had a good experience with physical therapy. And that kind of sparked it. At the time, I didn't realize it was 7 years of school and getting a doctorate.
Sure.
I may have changed my mind. Thankfully, it didn't once I found that out. And then got my bachelor's degree from ASU in exercise and wellness. Nice. And then went on to A.T. Still University right out here in Mesa and got my doctorate in physical therapy. So
you've been right here for a long time.
Yep. So. I'm Arizona. I got it permanentely. So
that's cool. I like that cactus.
Yep.
Wow, fancy details. So that's how a lot of practitioners get into it. You know, they have that personal experience, get some results. I had the same experience about chiropractic. So I was like, oh, this is exciting. And then I looked, I'm like, it's expensive and takes a really long time. So I got a little scared for a while and then pushed through. So
for sure.
So you graduated at AT Still, you start practicing. How long were you in practice for?
Yeah, so it was, we actually moved down to Tucson. So I was, the first part of my career, I was in the workers' comp industry. Okay. So I actually loved it. I had done a rotation. So in physical therapy school, the whole third year is just clinical rotation. So thankfully, I had spent a lot of time in a physical therapy clinic when I was going to undergrad, just working there and getting some experience as a tech. And that was kind of in the typical outpatient orthopedic sports type of practice. Sure. And so I wanted my clinicals to be more well-rounded and kind of give me a little bit of exposure to some different things. So I did a rotation in an outpatient neuro clinic. Shout out Advanced Neurologic Rehab here. And nice. I think they have 2 clinics now, one in Gilbert and one in Tempe or Chandler. And so outpatient neurologic stuff, which was very different from what I had been doing before. Sure. And then at a rehab hospital, and then at Concentra, which was the big workers' comp company. So then I ended up taking a job there. So
okay, nice.
So the cool thing was that the thing that I loved about working in that setting was I was seeing people basically the same day that they got injured. Oh, sure. So it was very cool to see.
Workers' comp is like you're hurt on the job, and then the job has insurance that covers that. Basically, is the workers' comp. So.
Yeah. And so kind of the way that those workers' comp clinics work is there's basically we call it the front end of the clinic, and that's where like the medical doctors are, and it's basically just an urgent care. So they do all kinds of other work related things, but for injured workers, they would come in, they would get basically evaluated by a medical doctor, and then the PT clinic hides out in the back. And if it's something that is musculoskeletal related, they will just walk them back, and they'll walk them straight back and say, hey, this person got hurt. Here you go. Do your thing. So it was cool to see people early on. And it really shaped, I think, the way that I continue to practice today, getting access to people that early in their kind of injury phase. So
which we were talking about this before we went live today, but like that's where medical stuff thrives, is in emergency situations, a quick type thing. It has a lot more trouble in the chronic stuff. Yeah. But when you can address an acute injury, you can see results pretty quick because the tissue's damaged, the body's trying to heal still, and you can make some progress quickly.
Yeah. And I think it was so cool to see, and the evidence is so supportive of that early intervention model. The earlier that we can get to those people, and the earlier and then a lot of it at that point, the first day I would see people is just educating them. Right. Listen, you're not broken. You're going to be okay. Sure. Your body's resilient. it's meant to do this. Your body knows this type of stuff's going to happen. Right. You're adapted to it. And right now you just need to let it calm down, let it do its thing, and start getting moving again. And
let the inflammation come down, let the body work through that, get, like you said, get moving, get the body round and move tissues. So
for sure. So, I mean, it was cool to see, most of it was, again, a lot of times I'd see the person for 15 minutes because I have 3 other patients in there at the same time. But I always wanted to make it a point that, hey, I need to at least have a conversation with this person today. Good. Because you can see the times where sometimes the person couldn't stay or they didn't even walk them back. And even in that little exposure I had to that, you can see how big of a difference it makes in the time that it takes them to recover, in their own beliefs about their body and what's going on and all of those things. So it plays such a huge role in it.
It is so important. It's a very often overlooked part of healthcare is taking care of the person, not the problem the person has, and being able to help them understand and educate them and give them just even some peace and comfort. Like, hey, this isn't a big deal. Mm-hmm. Yes, you were hurt. You were probably hurt pretty bad today if you're in this clinic, but like, here's what we're going to do to get it better. And just to calm that nervous system down so it's in a better spot to be healing.
Yeah. And I think, that's such a huge part of it. And just having, I think it's a really cool model to be able to have, there's a reason why we have different experts in healthcare, and there's a purpose for it. And so it's so great to be able to have that experience and have medical doctors too that trusted me and said, hey, you have a musculoskeletal thing. I'm not going to try to sit here and explain what I think about it because their knowledge about that stuff, they can't be experts on everything.
Absolutely
And
not.
so it's like, go back there and talk to PT and they'll explain what's going on and kind of give you the rundown, because it's going to be different, depending on who you talk to. And so it's just I think them having that different approach to it, because being a physical therapist, I think it's just, at least my approach to it is more of that, like empowering, like it's not talking, like you said, not focusing so much on the problem, but focusing on you as the person, and that you have the power right now.
Absolutely.
Your injury doesn't have the power unless you give it the power.
And we as the practitioners definitely don't have the power. Yeah. We have tools, but we don't have the power to fix people. We have the power to teach, educate, train, do some manual work, thing like that. But ultimately it is up to them to take charge of their health and get better.
Yeah,
right?
Absolutely. I think that's the big part too, is just empowering them to say, hey, I'm here to tell you these things, but whether you do what you need to do or you take what I'm saying or not, it's not me that's changing your body or changing your mindset. I'm just sharing, like you said, the tools, whatever that tool may be for that day that they hopefully need. And hopefully we're good at assessing what that actually is. But just giving them, ultimately it's passing the tool off.
Right. Well, and giving some peace and comfort in that, because when we're acutely injured, either on the job or an accident or wherever it happens to be, like there's a fear that comes with that. I remember once I was in a car accident, I had pain all down the right side of my body. I could hardly move. I wasn't sure I could work. There's so many fears going on.
For sure.
And for someone to be able to look and be like, it's okay. Yes, you're in pain. And I knew enough because I was a chiropractor at that point. Like they kept offering me medication. Like, hey, do you want some painkillers? I'm like, I'm supposed to be in pain. I was just hit by a truck. Like, I know I hurt. Yes. But like, it's nothing I can't handle,
My body doing its job.
It's telling me, hey, something's wrong here. So, and so having that, like someone to educate them, people get so much fear in that situation. When we're in fear mode, we're not in healing mode. We're not listening properly. We're not integrating information, and the body isn't going to heal as quick. If we can calm that system down as practitioners, we can do that quite easily. I shouldn't say quite easily. It depends on the patient. I make this sound like it's a cakewalk, but that's the hardest part of what we do, is getting their systems to calm down and teaching them that. But I mean, simple little things like, hey, putting a hand on a shoulder, looking, eye contact, being able to connect with people and say, this has happened before. I've seen a lot of people like this. Yes, it's not fun now. Here's what the plan is. And just give them that comfort of, okay, someone's here to help me. Then they can take charge of their health more. For
sure. And I think, getting into even some of the other things that we might be talking about here in a minute is just the healthcare model and the fact that that is not what a lot of people get nowadays.
No, sure.
And when you only have 5 minutes with a patient like many of these medical doctors do. Of course, all you're going to do is, what's your symptoms? Here's some medication to deal with that. And so much more of, and again, talking about the chronic pain thing, I think so much of the reason why things even ever get escalated to that level is because in that moment, in the beginning, when you have the most chance to make an immediate change and kind of set the course for where it's going to go, that you're not talking about lifestyle modification. You're not talking about the way your emotions and how you feel about it. You're not talking about your previous experiences with similar types of pain and how you handled it then. And, you know, they're not really getting a well-rounded approach. It's, this is what I do, and this is what you're going to get, and this is what insurance pays us for. So this is where we're going.
You really get 3 things typically in those situations. It's like diagnostic testing to make sure nothing worse is wrong. That comes back clear. Okay, so here's some painkillers, here's some muscle relaxers. Yeah. It's like, well, no, the body's tight, the muscles are tight, and it's in pain for a reason. Like, what are some tools? What are some ways? And so you get acute issues translate into chronic issues because nothing's addressed, nothing's corrected in that moment. It just, eventually the pain diminishes, body heals to an extent, but I have these underlying patterns there. Yeah. It goes back to what you said a little bit ago though, too, like doctors can't be experts in all things. The human body is arguably one of the most complex mechanisms on this earth. And so we have these doctors, you know, especially general doctors, ER docs, stuff like that. They're trained in certain things. Look for major things. That's their main objective. Look for something majorly wrong. ER docs, it's like, make sure they're not going to die in the next 10 minutes. Yeah. You know, like keep them alive. Keep them alive. They're not experts on everything. Yeah. I got a great brother-in-law who's a doctor, a medical doctor in the ER. And like, I'll ask him questions sometimes. He's like, I really don't know. I don't deal with that on a regular basis. And that's something doctors should say more. But 100%. That's why having more than one doctor on your team is huge, and having that expert and even some of this integration like you had in that clinic. Yeah. People in the front handing people off to the people in the back and vice versa when needed. So
yeah, for sure. And I think, you know, that and being in that environment, and like you said, that acute pain, then, you know, chronic pain always starts as acute pain. Absolutely. It doesn't, that's the reason it's chronic, because it started at some point.
Started with some sort of injury, something broke down, and then it couldn't fix itself.
Yeah, for sure. So, you know, it always started somewhere. And now with kind of more of what I do in day-to-day practice is dealing more with chronic pain. So it's been a really cool experience. And I think it's helped me be well-rounded in what I do, because I've worked very closely with both ends of the spectrum. I've worked very closely with the acute side, and most of those patients I saw for a week or two, sometimes one visit. Sure. And in that one visit, they walk in and they're hunched over, and they looks, if you had asked them, they probably would have thought it was going to take months or years. Sure. And then they come in 2 days later and they're like, hey, I'm ready to go back to work full duty. And it's, again, I think a huge part of it is just because of that early intervention and just giving them some education and just listening a little bit to what they got going on. So,
well, and that's like, when people come in with acute pain, it's a lot easier of a conversation. As a chiropractor, when they come in with 25, 30, 50 years worth of back pain, I have to have a deep conversation with them. I have to really be explaining, like, this is going to be a process. Like, patience, you know? And I can say it till I'm blue in the face, and then they come back 2 weeks later and they're like, I'm not better. I'm like, no. Yeah. Like, of course not. Like, I never expected you to, and I told you wouldn't be, you know. And so being able to transition from that. Before we dive too much into chronic stuff, though, I wanted to touch base on your transition there. Oh, yeah. So you left physical therapy. Why? And what led you to come back?
Yeah. So, you know, my wife, Jamie, she had started a business and it was doing well. And so at that point, I think that I probably was more than I maybe would have thought at the time. I probably was burned out. Sure. You know, that workers' comp setting is
5-6 people an hour every day.
It can be very heavy, which I feel like I operate well in that environment, but at the same time, there's a difference between being able to operate in it, and some of that is probably just being able to tolerate the burnout better than maybe most people, but it doesn't mean that it's not there.
Right. Absolutely.
And so I think when I saw the opportunity to do something different and
take a break.
Yeah, it was it was like, yeah, let's do it. Let's jump in.
On such a big topic, I see a lot of with people. Like, I talk a lot about stress in practice because stress plays a massive impact on how well we heal, how well we function, our whole quality of life. And so many people are like, I'm not stressed.
Yeah.
Like, yeah, you are. Like, you just told me what you do for a living. You told me how many children you have. You told me like all this sort of stuff. You are stressed. You just feel like you're handling it well. We kind of get almost numb to it, or it's just, we're so used to it. We're not really noticing it. And so I try to emphasize the difference between stress and stressors.
Yeah.
Your life was filled with stressors, all these different things. And so your brain was like, hey, break, let's take that. Right.
Yeah. Yeah. And so, just the feeling like, oh, it's going to be this freedom and we're going to be able to do what we want more and all those things. And
when you started a business, right?
Yeah, exactly. Before you actually get into it and realize what it is.
Yeah.
And so, we went all in.
Nice.
I left my career. We moved back up here to Phoenix from Tucson, and it was great. And it was a lot of learning experiences.
Sure.
And, I think it's learning a lot more about stress and how I handle stress. It was a very fish out of water experience for me, right?
Which probably translates well as a physical therapist. What you learned through that now makes you a better practitioner.
For sure. And I think, like you said, talking to people about stress, because I even talking about the burnout in the moment back then, I have had a pretty, at least in my recalling my life, I've had a pretty smooth sailing life. Things have kind of always, had kind of felt like they always worked out the way that I wanted it to work out. And again, I think that there was always stressors there, and maybe I just didn't recognize it. But then being tossed into an environment that I was not comfortable in, it was not my wheelhouse.
Sure.
And it was a very high stress environment. And even my health, I had all kinds of stuff going on with my health during that period of time that, in the moment feels very real.
Right.
But now being on the other side of it and thankfully knowing what I know about my body and how it operates, I can look back and be like, that was just stress.
Right.
That's all it was.
And it's often not even just stress, but stress breaks you along your weak areas. So maybe you were discovering some of those weaker systems in the body through that stress. But a lot of people don't think about that until they take a step back. One of the things that's really interesting is I did some research into burnout a while back. And a lot of experts say it can take 2 to 3 years to recover from that. When you really, truly experience burnout, it takes the body and brain a while to heal and process and come back. So,
yeah, for sure.
Which it says, be patient, give yourself a lot of grace in those situations. When you're looking at going back, I know probably not relevant to the podcast, like why you left the family business, but like, what were the things that drew you back in? What was the stuff that pulled you back towards physical therapy?
I think the biggest thing was just I underestimated how much I would miss being a piece of the puzzle to people improving their quality of life. And I think that's the biggest thing. And, I've always kind of, even like when a lot of times when I'm doing an initial evaluation with a patient, I will tell them, listen, my job here is to fire myself. My job here is to educate you and pass the tools off to you so that you can not only help yourself right now, but that the next time that something like this happens, you can start to know what to do. Right. And I'm here if you need me again. Sure. And you may, but I want to at least give you the tools that you can do it. And so, just kind of being a piece in that puzzle and getting to be a part of that journey for people, it's rewarding. I mean, it's why we all got into it in the first place. So.
Yeah. When someone comes in and can't move, and then you see them out there, living life, going on hikes, running, doing stuff they enjoy, that's so satisfying. So.
Yeah, for sure. And it's, being in the business world, there's not as much positive feedback. Right. It's a lot more negative feedback, I think, in that area, which is fine too. And I think that was a great lesson for me to learn, and has, again, kind of helped and shaped the way that maybe I treat people now and improved that as well. So, I think it's all part of the journey and all part of the learning experience of life. But I think I underestimated how much I would miss being a part of that. journey, really what it is.
And then as you came back into physical therapy, now you work in a very different clinic, more integrated and more chronic. Let's talk a little bit about that, like how that approach. We were discussing this extensively a couple weeks ago. Like chronic disease requires a very different approach and typically a very integrated approach. You know, acutely, you hurt your knee, physical therapy, do some basic stuff. You don't necessarily need to we talked about the emotional component, manage stress levels, diet, things like that aren't as big of a deal. But when you're dealing with a chronic issue that's been building for a long time, it's going to take a multifaceted approach typically to resolve this or to get it back.
Yeah, for sure. So, the place that I work now is, again, just that. It's integrated, outpatient program. So everyone gets physical therapy, behavioral health services, and then we have medical providers. And a lot of, dealing with chronic pain, mental illness, substance abuse, all of those kinds of things. So again, very, very opposite end of the spectrum from the workers' comp world that I was in. But I enjoy it. And I think that even the way that I practiced in that acute pain setting is really what those chronic pain people still need.
Sure.
They just never got it. And so that is more of the problem, is that, because they, unfortunately, whether it be that they didn't get it shared with them, or it may just be that they weren't receptive to it at the time. It's not always the healthcare system's problem. But for whatever reason, again, that, like we talked about, that acute pain became chronic, but the way that it needs to be treated takes longer, and you have to dive deeper. But ultimately, the principles and the educational pieces, they're all there, and they should have been shared in the beginning. And maybe they were, but it's really the same. You just have to kind of go to a lot deeper level.
Well, because what happens, you have that initial injury that's still there, and then you have all these layers on top of it. So you have to go deeper because there's protections and stuff in place on there.
Yeah.
It's really true of like most things, even in the behavioral health side. It's like, hey, I'm overwhelmed or feeling depressed now. It's like, well, this is a result of something that happened to you a long time ago. It's some sort of injury emotionally, and then that built up into where it's at today. And so really we had to do a lot of heavier moving to get down through those layers, get to that initial injury, heal that, and then let the body move forward. Or I guess I should say we got to get out of the way what's not letting it heal, and give you the tools so you can heal that.
Yeah. And I think it's interesting too, the more you like you have done, is, diving into pain science and how pain works and how our bodies operate, and how, tissue damage and your experience with pain are very much not related to each other. Absolutely. And you can, like your experience about being in a car accident, right? Yeah. How many times do you hear someone's in a car accident and they got out of the car and walked across the street, and then, oh, my ankle is broken.
Oh, sure.
But they didn't even recognize it. Yep. And so in that moment, if pain was very much associated with tissue damage, that person would have not been able to do any of those 100%,
things. Yep.
So I think that's kind of one of the first steps, is just getting people to kind of dissociate those two factors, and going into it and saying, that you have nociception, and then you have the way that your body, interprets those signals that your body is sending it. Sure. And that is ultimately what determines your pain experience. And I tell people all the time, especially chronic pain people, you've probably been told that the pain is in your head, and it's not fully wrong, but unfortunately you probably didn't get an explanation of what they mean by that. Sure. And not only what they mean by that, but how you can actually leverage that in your advantage. It's not just, it's in your head and that's it. How
can you hack the system to get through that? Yeah. Because there is the head component. I was thinking of this when you're saying that, like you get the tissue damage, you get the pain, and then you get your emotional response to the pain, which plays a role too. And that's all needs to be addressed. This is where the layers and integration comes in, because I have people that are like, I had a guy in a few years ago, 80 something years old, chronic pain for many years, comes in, he's like, he's a farmer, He said, I've had back pain for a long time. Like, I'm too old. You can't help me. I'm like, well, you're here. Like, why are you here? I was just, but I said, I can. It's not going to fix it overnight. You're 80. You've been farming for 65, 70 years. Like, it's going to take a while. So I adjusted him. He came back a week later, 2 weeks later, actually. He's sitting there. He's like, I still hurt. Like, yep. We talked about that. I planned on that. Like, you guys, you're still hurting. I'm just too old. You're not going to be able to help me. And he was just set in that, you know? So, he refused to listen to anything. He's 80. Apparently 80-year-old farmers are stubborn. Who knew? But, right.
Makes sense.
We go up front though, and we're talking to his wife, and his wife's like, yeah, so he's been in pain this week, but usually he just sits in this chair all day long. Mm-hmm. And I said, yeah, so he sits in his chair all day long, doesn't do anything. She's like, but this week he's actually got up several times. He helped me cook dinner one night. He's done the dishes a few times. He's moving around, but his mind was so focused on it hurts that he didn't see anything else, you know? And that's where the mental component comes. But then, like, again, diving into gaming that. So elaborate on that a little bit.
Yeah, I think that's a great way to look at it. And like you said, you know, it's kind of like gamifying the system, and although it is a product of your brain, that it is still telling you something. And I think that that is important to tell people that are in chronic pain that they don't get told enough is that your experience with pain is real 100% of the time. I will never tell you that the pain that you are feeling is not real. Right. Nor should you, because it's not
that
you.
Phrase, it's all in your head, has just caused so much damage for people.
So bad. So bad. So I think that's the first thing, is letting them feel like they have an environment where someone believes them.
You're validating their feeling. Yeah.
They probably haven't, unfortunately, had that. They've been just given medication and been given up on because the very surface level interventions that the medical system was throwing at them to try to fix this chronic problem were not working. And so,
or they didn't see anything on the MRI, or it wasn't bad enough for surgery. So, like, well, here's painkillers. Call me if it gets worse.
Exactly.
Yep.
And so I think that's the first thing. I think just validating them that, listen, you are feeling pain and it is real. That's the first step to then get to, okay, but why?
Right.
That's the big next step. But why?
Right.
You know, and so, and that, but why can open a can of worms.
Oh yeah. There can be 18 things contributing to that why. Yep.
And like you said earlier, you know, you talked about the body and how it's so complex and how we have all these specialists. Well, pain within your body system, I think, is one of the most complex things within our body and how it responds to things. And so, you know, you got to look at really their entire lifestyle.
Sure.
You need to be looking at, okay, what are you putting into your body? What are you eating?
Absolutely.
What are you eating that may be contributing to this? What's your previous experiences with pain prior to this that may be shaping the way that you're experiencing it this time? What is your current emotional state? What are your stressors?
Sure.
What's going on in your life? What types of things maybe make your pain worse and make your pain better? And then maybe that can give you an idea, and it might point to some of those other factors we already talked about. But I think that is just really the part that opens up Pandora's box in a lot of ways.
Right.
But it's
also opens up the solutions.
Exactly. Yeah. Opens up to, it's not going to be one thing that we need to do in a chronic situation. It's not going to be some magical thing I do with my hands that's going to make you better. It's not going to be some very specific exercise that I give you that makes you better.
Not one little adjustment, one little tweak that's going to change it all.
Yeah, that's a perfect way that I explain it all the time. I said, we're just turning the knobs.
Right.
There's a lot of knobs that have been turned that are making your body respond in this way. And we're going to just start turning knobs, and we're going to turn the knob, and we're going to sit back and say, what does that do?
Right.
What did that just do?
We got 10% better. Okay, let's turn another one. Let's keep pushing. Yep.
Exactly. So it's really it's a trial and error. Absolutely. And it's turning knobs, and it's realizing, how does your body respond when we turn these knobs?
Sure. And
then can we find the right combination of which knobs to turn to end up getting you on that path to healing? And it happens all the time for people.
It's so huge because so often people are looking at, like, what's the thing causing my problem? And they go from one thing to the other thing to the other thing and get more and more frustrated and lose hope. And I tell them all the time, like, it's not the thing. I do one thing in my office, and it's not the thing.
Yeah.
Like, there's so many things out there, so many different practitioners that are good at what they do, that often I love my home runs, you know, when I do one adjustment and they're doing fantastic. Those are fun, but for the most part, it's not a home run. I, work on them. We get them to second or third base. I was just at a baseball game last night.
Yeah,
so baseball references, my first one in like 5 years. So I'm all baseball minded, but no, it's like we get to like second base and then we need another thing to get us to third base and then kind of bring that whole full circle so the body's able to heal. And unless we're looking at the whole picture, we're not getting there. If someone's not drinking any water and just coffee all day long, they're dehydrated.
Yeah.
They could be doing everything else right in life, but they're dehydrated. And that's setting a foundation for stress on the system that's not going to let the body heal. So we talk about basics of dehydration. Sleep. How are you sleeping? How much are you sleeping? How restful do you feel in the morning? All these little factors play a big role in it.
Yeah, for sure. And I think the other part too that's important especially in those initial stages of dealing with someone with chronic pain especially, is letting them know that it's not going to be a clear path to recovery. It didn't happen, like you're saying, it didn't happen fast. So it's not something that's going to just get better fast. Sure. More than likely not.
Well, the road to success does not look like this. No. It's a wild roller coaster that zooms around and plateaus at times and sometimes dips down and then has to come back up. There's a variety of routes that we have to follow along
absolutely.
that.
And that's always something that I try to do my best to set the stage for that in the beginning, because a lot of times they're going to get discouraged. They're going to feel, hopefully they feel a little bit better. Like you said, you get a base 100%. Hit that first visit.
Right.
Awesome. We're off and running.
We're moving in the right direction.
We're off and running. Yep. But then you might hit into a double play and now you're back to square one and they're like, I feel exactly how I did before. Maybe sometimes even worse. Sure. And but if you warned them from the beginning that this is going to happen, their response when those things happen can drastically change. And going back to that turning the knob, okay, well, that was the wrong knob. We just need to turn that knob. We just need to turn that knob back the other way. And maybe it's that knob needs to be turned, but maybe it's just not yet. And that's why it's so complex.
True. Maybe that knob turned because there's something else that's not fixed. I see that a lot. I'll tell patients, they'll come see me for chiropractic. They're like, I've tried PT, I've tried massage, I've tried this. I said, yes, but once we get the framework balanced out and you go retry those things, they're going to have a very different effect. And a different massage therapist, a different physical therapist, a different naturopath is going to have a different effect because they know different things. And so getting that multifaceted approach there is really key. I want to hit on a couple of things, just kind of a recap, like when people are dealing with chronic problems, feeling validated, understanding like there's a reason why you feel this way. Yeah. You don't know it yet. You may not know it. You may not know all the reasons, but like accepting that, understanding there's a way to move forward, and then seeking out practitioners who are going to listen, who are going to validate what they're feeling, and are going to offer different tunings, different methods to try to master and overcome this challenge. And again, multiple practitioners makes a big difference. So.
Yeah, for sure. And I think that's a big thing when, when people especially people that are dealing with chronic pain and have been other places, is look for something different.
Absolutely.
Don't keep going back to the same place. And, those things to look out for. If you walk into a PT specifically, if you walk in somewhere and you see everyone doing the same things and there's not a lot of talking going on, I think that's such a huge piece because, the exercise and the getting your body moving and giving your body those inputs is an enormous part of it. But again, like you're saying, it's only a part, it's a knob. And, I think another big thing is looking for practitioners that use language that empowers you and doesn't make you feel like you're broken or that your pain is who you actually are or, diminish your feelings about your pain and makes you feel like we talked about, letting them feel validated. If you have someone that doesn't let you feel validated, that at least it's real, then I would say go the other direction.
I was thinking two phrases. There's a really big difference in how to explain something. And so you get a doctor that says there's nothing wrong with you versus a doctor that says, I'm not finding anything. Yeah. Huge difference. Same concept. Like I don't see anything wrong versus there's nothing wrong with you. Yeah. Because then people are like, well, then why the heck do I feel this way? They get really upset and stressed, and then they're beating themselves up and all this psychological stuff. So I wish if there's a doctor listening, please change your language, because so often that's happening. But if a doctor says that, if a doctor says there's nothing wrong with you, I tell people all the time, that doesn't mean there's nothing wrong with you. That means they don't see something wrong with you. other people may find stuff going on, some levels of dysfunction that this doctor just didn't have the knowledge to assess and evaluate. You know?
Yeah, I think that's a huge thing, even about imaging, where I always tried as much as I could with patients, and not that I'm perfect at it or an expert when it comes to it, but I said, listen, I see you way more often than whoever is reading you this still picture of what's going on in your body.
Usually you're laying down. Gravity's not even playing a role. Yeah.
It's a static image. And
Absolutely.
Does it mean that it's not helpful? No, it does mean that it's helpful, but it's part of the picture. And, you get these people that come in and now all they can do is associate the way they're feeling with the static image and that, it said I have degenerative disc disease. Yeah.
I see that all the time. Yep.
So does that number one, that's been there even when you weren't in pain.
Mm-hmm. That started a long
so does a
time
lot
ago.
of other people that are in zero pain. Yep. So I always try to make it a point, if I know that I have a patient that's getting imaging, I said, take it with a grain of salt, bring it to me too, and let me decode it a little bit and translate it.
Yep.
Translate it.
Exact same thing.
Because it can be scary. And unfortunately, the way that we named a lot of degenerative disc disease, it's like normal age-related disc changes. Couldn't we have named things a little bit different and then, taken into account the person that's there in front of you and how they present and not
and then we label
image,
it mild, moderate, and severe. You have severe this and patients are like, what do I do? And I love to translate. I like that decoding it with patients because it is. And I'll tell them a lot of times, well, you're 65. Of course we're going to see something on the imaging. You've lived 65 years on this earth. You've had a lot of injuries, accidents. Let's explain what that means. And my favorite one is arthritis. The doctors see that and they're like, you have arthritis. I'm like, okay, arth means joint, itis means inflammation. Your joint's been inflamed for a long time, so it changed shapes. Yeah. That's what that means. Doesn't mean you have to have pain. It doesn't mean this is going to be a chronic problem.
Yeah, for sure.
I love that you have that mindset. That's why I had you on the podcast today because we have to question these things and accept that there's other possibilities. Too often people get one opinion from a doctor. Mm-hmm. This is where I'm at. And so many people wear their diseases they were diagnosed with on their sleeve. It's like, I can't do that. I have arthritis. I'm like, okay, let's talk about options. Let's work through some of that. So I want to thank you for being on here. I think we could go on all day, but our listeners need to get back to whatever else they're doing. But you do have a way, you're doing some cool education stuff you're just telling me about. So you have an Instagram where you're sharing a little bit about this sort of stuff. What's that? Yeah.
So I, again, talking about a lot of this stuff we've talked about, even after the phone conversation that we have, I think that's probably some of what sparked the fact that I needed to do this. But like you said, I think one of the biggest challenges is just education.
Absolutely.
And it's easy for, I feel like I have the tools that could benefit people, and not everyone, but if it can benefit anyone, then cool. So I just started a little Instagram page called Hawk Pain and Performance.
Hawk like the bird.
Hawk like the bird, like my last name. So, and really it's right now, all it is I'm just posting all the stuff we talked about. I just got a certification as a functional nutritionist for chronic pain.
Nice.
Things like that. So I really try to just hit on all kinds of stuff that I see day to day and stuff that I see that helps people, and just share it so that people out there can try stuff for themselves and hopefully help someone feel better and get over their pain.
Awesome.
So
well, we live in such an age of information, so there's so many great resources like this. So definitely check out Hawk Pain and Performance on Instagram. People are always like, don't get your medical advice off of social media, but don't be diagnosed off social media, but there's a lot of great things to learn. And I'm so glad that you're sharing because you have so much to add to that conversation about giving people that power to take charge. So thanks again for being here, Tanner. So thank you all for tuning in. Tune in for our next episode in a couple weeks. So have a great day, everyone.